discuss a paper, labia length and patient symptomatology. Is there a correlation? Women request labiaplasty for many different types of symptoms and reasons. For example, many women complain of pain and tugging with sex or with sports like riding a bike or running or playing volleyball. And some people even have pain just sitting in a chair. And then there's the psychological impact related to appearance or partners' comments, and sometimes comments from sisters, and especially when the girls are young. And there's many studies that show that labiaplasty really relieves these symptoms dramatically. So this brings to mind, since labiaplasty is about reducing the length of labiaplasty, are women with longer labia more likely to have symptoms? Insurance companies and National Health Services believe so. In fact, they often have a cutoff length, and those who don't qualify because their labia are too short are sometimes referred to psychotherapy, just to get them used to the fact that they have normal labia. And this is done instead of referring people to private practice for private pay because it's, say, a cosmetic procedure. So the purpose of this study was to answer the question, is labia length correlated with symptoms? And to answer this question, my co-authors and I looked at some of the responses to a survey I give to my labiaplasty patients about their symptoms. A high score means a lot of symptoms. A low score means not very many symptoms. And then we also compared these with the length. When I measured patients, I measured the exposed portion of the labia, the part that shows below the hair-bearing labia majora when, say, a woman's just standing right in front of you, and also the total length, the length of the entire labia. And what did we find? Well, not what we expected. The correlation between labia length and symptoms is weak. And the correlation between the exposed labia length is even weaker. It came out as what we would call very weak. So clinically, this means that labia length is a poor indicator of patient symptomatology. And in fact, some patients with zero exposure had very high numbers in their symptomatology questionnaire. And we had patients with exposure of like 3/4 of an inch or thereabouts, and they had very low symptomatology. And so what does this mean? What's a takeaway? Well, patient-reported symptoms rather than labia length should be used to determine labiaplasty candidacy.